everyone. Thanks for having me. Today, I'm talking about how you actually get patients, opioid use disorder, pregnant or postpartum patients into treatment. It's a fairly straightforward subject, and so I don't think it'll take too long to get into the slides, but just wanted to talk a little bit about some good resources, a few actual programs just in some of the areas around the state, and then briefly touch on methadone versus buprenorphine and what direction you might go in. So DAODAS, D-A-O-D-A-S, so the Department of Alcohol and Other Drug Abuse Services, is specific to the state of South Carolina. It oversees all the operations in the state that are, the prevention and treatment and so on and so forth of substance use disorders in general, not just for pregnant women. But what they've done, they basically have these treatment centers called 301 centers based on something called Act 301, and that has diverted federal assistance funds to treatment of addiction and substance use disorders. And one thing that's relevant just in general, but specifically relevant to the population we're talking about, is that if a patient is unfunded, then their treatment for opioid use disorder will be covered by federal dollars. And as I'm sure everybody on the call knows, this is a particular problem when Medicaid runs out postpartum. So even after somebody's Medicaid runs out, then they should be able to get treatment that is funded, even if they don't have insurance. And they've got a great website that's got all sorts of resources, and they've got an entire list of all these 301 centers. So you just search by city, and then you can find, search by city, and you can find the one that's closest to you, which is very, very helpful. SAMHSA is on the national level. So this is the Substance Abuse and Mental Health Services Administration. It is under the department, the HHS, so Department of Health and Human Services in the federal government. It is a source of treatment guidelines. They provide grants for research. They collect data. Similar to the DAODAS website, they've got just a lot of really helpful links and resources. And one thing that I specifically wanted to point out, which can be really helpful, is they've got over here on the right-hand side, you can see they've got an actual provider search tool for Suboxone. Comes up with a big map, and you click the state, which for us would obviously be South Carolina. But even if you have a patient that's coming from Georgia or say North Carolina, you can click those states, and then you search by zip code, and you can input however many miles, from that zip and search, and it'll come up with a whole list of whoever is registered to prescribe Suboxone in that area. Like I said, so that's super helpful. So I'm going to run through a couple of actual treatment centers just to give you guys an idea of what is out there and what kind of treatment is available. And then I'll highlight below just the general info, the programs that are relevant to women in general, but pregnant women and postpartum women. So in Charleston, and all these that I'm going to run through are all one of those 301 centers that are funded by DAODAS, that funding comes from federal dollars. So Charleston Center is what we have here in Charleston. It's pretty comprehensive. It's got outpatient, intensive outpatient, and inpatient, including detox. So some of you guys may be familiar with this, some of you may not, but outpatient is sort of like your general clinic, seeing a counselor, seeing a psychiatrist, or whatever that might be. Intensive outpatient is, as the name implies, more intense. It's more hours per week. So it might be 3 days a week, 5 days a week. It just depends on the program. And so that will involve, depends on the program, but will involve groups or individual. Usually they see a counselor, and then it will occasionally meet with a doctor if they're on staff. And so that can be a really cool option as well, a little bit like a step down. And then you can be inpatient, like for inpatient, more comprehensive, quote unquote, rehab that's more long-term. And then there's something, detox would be different. That's more specifically just to detox somebody and provide them whatever medical needs they have during that detox. That's not going to be a really, really long-term stay. So Charleston Center has all of those options. And they're actually also a a center that prescribes methadone, which you'll see over the next couple of slides is not the norm. Most places have buprenorphine these days, but methadone, as we know, is there are only those specific centers that provide it, but Charleston Center is one of them. All of these places provide, Rachel, if you'll scroll back, I'll talk about the New Life program really quickly. So it is an inpatient program for women who are pregnant or with small children. So you can have up to 2 kids with you that are age 5 years old or younger. So we see those women in our clinic with some regularity. Typically you can just walk in and get assessed, but I saw on the website when I was looking things up for this presentation that now you have to call and you can get assessed by appointment. But it's fairly easy to get an assessment and get involved in any of these types of programs. Okay, so sort of a funny name, but Loredac, which is in Columbia, it's another one of those 301 centers. You can see serves those in Lexington and Richland counties. You can see the services offered. It's the same sort of theme as Charleston Center. They do have something, which I didn't know this, and other people in my group might have, but they have something called the Maternal Outreach Management Services. I don't know if Dr. Campbell, you know more about this maybe than I do, but it's apparently a resource for pregnant women that partners with local providers and social services and other resources to engage them in treatment and give them good quality care. And all of these websites will have the detailed information on like how does somebody get established? Do they have walk-in times? Do they need to be referred? Can the patient just call? So I'm not going to put all that detail on here because that would be I think that would just be information overload, but the websites, especially because they're these funded centers, are really comprehensive. Shoreline is in Conway, so services that sort of Conway, Murrells Inlet, Myrtle Beach type area. They have outpatient and intensive outpatient. They don't have like an inpatient sort of rehab similar to Charleston Center would. But a couple things to mention is that we now have a partner, a tele-psych partnership with them. So any pregnant person that will be seen, that comes to Shoreline for treatment will be seen by one of our psychiatrists for their MAT or med management. They do have 2 programs for women specifically. One is a residential treatment center that's aimed at women who are at risk of losing their children to, DSS. And then there's also this is the women's intensive outpatient program that doesn't have to be a pregnant person, but just tailored to women specifically. It's a group-based program. And then 2 more important places to mention that have specific inpatient treatment for that will accept pregnant women and do MAT. So MAT is buprenorphine and methadone. I'm sorry if nobody had known that, but if somebody hadn't known that. But there's a place called Serenity Place, which is a branch of the Phoenix Center in Greenville. They will accept pregnant women or mothers with young kids, up to 2 kids. And then there's the Chrysalis Center, which is a branch of Circle Park in Florence, and they will accept pregnant women. Well, not just accept, but they have a specific program for pregnant women or women with children up to age 10. So there's more out there than I think we might be aware of. And then last but not least is us, MUSC. So these things listed up above are just in general MUSC. We have a freestanding psychiatric hospital that has a dual diagnosis unit, meaning people that have substance abuse issues in addition to another psychiatric issue, whether it's depression or bipolar or whatever it might be. We do not have a detox center, or someone would not be admitted to our psychiatric hospital just for substance treatment. But we do have some outpatient programs that are just for substance treatment. And then our clinic is the WRBH, Women's Reproductive Behavioral Health. We treat pregnant and postpartum women for the whole spectrum of stuff, including substance use disorders. We prescribe buprenorphine. We have opportunities for clinical research, which I'll make one mention of that in the next slide, but they do not have to be a patient at MUSC. We can see women from all over the state, especially now that we are still 100% remote, but we see patients all over the state of South Carolina. And the one thing that's nice is that you're able to see the physician directly. And so you'd be scheduled to in our quote unquote walk-in clinic, which is just sort of a misnomer left over from when we were in person, but they would get scheduled, and our wait times are within 2 weeks. It's usually a week, 10 days or so. This is how, for us, we do sort of an online screening portal for people to, they basically submit an initial screen. Then our care coordinator, who's a social worker, receives the results of that screen, and then she reaches out to the patient to do a phone call to assess their level of need and then get them scheduled in our walk-in clinic if needed. But this is the directions on how anybody, the provider does not have to do this, so it can just be the patient who does this themselves online, and it's free. So special shout out for pregnant women with OUD. We want those women, definitely. This is a cell phone number that you can call to speak with or leave a message and get a call back to speak with an actual team member. We are evaluation and treatment, but also, like I mentioned, we have currently an ongoing clinical trial that's accepting participants for sublingual buprenorphine, daily buprenorphine versus long-acting injectable buprenorphine in pregnant women with OUD to assess various maternal and infant outcomes. And that if they're involved in that trial, their medication is free for the duration that they're in the trial, which is great. This is just a quick note of, if anybody is not aware, each county or a collection of counties will have a specific mental health center. You can find this on the I think it's like sc.gov, or I can't remember if it's DHEC or what it might be. But this is just a list of mental health centers by county, just to make you aware that they do exist, and that's never a bad place to start if you're not sure what else to do. So now, especially with how commonplace buprenorphine is currently, you can pretty easily search, either like I mentioned, using that Suboxone search tool on SAMHSA, or just Google, like Suboxone.com. You can search for providers, same with methadone centers. All this is fairly easily searchable, but I think getting them just to a clinic or a provider will be the first step, rather than trying to rack your brain on exactly how to go about doing this. But like I said, the information online is pretty robust and can be pretty helpful. One last slide. If you're wondering, well, which should I try to find somewhere that has methadone, or is buprenorphine okay? These are some just very general guidelines. By no means is it super black and white. For methadone, you would consider, have they had previous really good success on methadone? Did they previously require a high dose of methadone? Is it like an intravenous heroin serious addiction? Do they need that daily structure and support of having to go, every single day to get their prescriptions? Or have they been on Suboxone in the past and it didn't go so well? But one thing to keep in mind is that it wasn't that long ago that methadone was sort of the treatment of choice in pregnancy, and it wasn't unusual for the thought to still remain, or the question at least to remain, of should I switch somebody from Suboxone to methadone, or not even considering Suboxone because they were taught, or whatever it was, that methadone is what should be done in pregnancy. So that's why I put a star next to previous success on methadone, because some people either didn't have the means to have Suboxone, or just wasn't an option in their area, or whatever it might be. So like I said, just a general guideline. People receiving buprenorphine should be able to adhere to a little bit of a less structured outpatient program. So it's generally weekly visits for the first month or so with random UDSs, no early refills. It's a pretty stringent guideline to the programs. But if somebody's able to be okay with not having to only get their, that single dose for the day, then buprenorphine is a great option. And breastfeeding's okay for both. Maternal outcomes are pretty similar for both, like Dr. Boyers mentioned a couple weeks ago at the last echo, talking about buprenorphine versus methadone. So these are just some basic considerations. And then that's all I have. I'm happy to answer whatever questions that anybody has about this.
Thank you so much, Dr. Smith. Before we go to questions, I just wanted to give a shout out to other telementoring programs in our state. We actually have an echo specifically focused on substance use disorder and opioid use disorder. And we meet the first and third Friday of the month. If you'd like more information on that, you can reach out to me. And there's also a hepatitis C telementoring program run by Dr. Ahuja, who is located where Dr. Campbell is located at USC. And if you are interested in joining that program, you can see the information listed here as well.